Hello, my name is Jordan, and I'm going to be talking about human subject research today and how to do so ethically. So, within human subject research, there are 6 components to make sure it is done ethically, and this includes institutional oversight, informed consent, the lack of coercion, minimization of risk and discomfort for the patient, inclusion of debriefing, as well as confidentiality for the patient. So, institutional oversight requires an IRB or an institutional review board approve the experiment and basically ensure that the investigators are acting ethically within their trials. Informed consent is the concept that the participant is educated enough and coherent enough to agree voluntarily to the experiment that they're going to be taking part in and understand the risks that may come along with it. No coercion is the idea that there is no force or persuasion allowed by investigators to influence the participants to take part in their trials. And there is also the idea that there needs to be a minimization of risk and discomfort for the participants and the assurance that everything they're doing is absolutely necessary. Unfortunately, within human subject research, ethical guidelines are usually reactive rather than proactive, so a lot of times it is in the hands of the investigators to make sure they are acting ethically to keep their participants safe. Amongst behavioral neuroscience, a case where it would be harder to reach these ethical guidelines would be if you were studying a vulnerable population. For instance, if you were studying mental illnesses within children, children are considered a more vulnerable population, and it would be more difficult to reach these guidelines. The IRBs would require more information to ensure that you are going to be handling this case ethically and you are going to be taking care of your participants. It would be more difficult to gain informed consent from children, as it is harder for a child to understand the extent of what they're signing up for and the potential risks. Within a vulnerable population such as children, coercion is more likely to take place, as a child is more likely to be affected by an authority figure, even if that authority figure is a doctor or researcher. Investigators would also have to more heavily debate on what type of technique to use, as children are, again, a more vulnerable population, so more care needs to be taken when minimizing risk and discomfort, especially within neurological studies. Overall, human test subject research is super important within the research field, as it does help us expand and gain knowledge. However, it is equally important to make sure we are gaining this knowledge in a way that is ethically sound and is doing so in a way that protects the participants involved. Thank you!